The live stream is getting ready to launch.
Yeah.
And usually about now, even though it says we're not live, usually we're just live already. So,
Okay.
so, try not to pick your nose right now. Okay, here we go.
Here we go.
So stop picking, no picking nose.
Okay.
We are live. So I want to thank you for being here. I'm here with Dr. Neel, and please excuse me. Is it
Bulchandani?
Bulchandani. Yes. Thank you so much. We are going to be doing about 30 minutes here, maybe a little bit longer. I put in a request. I've got a print job I have to pick up. Let's see. Let me see. Oh, he replied. Yes. All right. We can go all the way to 4 Eastern. Let's do this.
Okay.
So we're going to hang out for about half hour, 45 minutes. And we are discussing something that I know that I've struggled to understand over the past years being in the world of breath work. Many of you have read the book Breath by James Nestor, and he talks about this. There's a lot of discussion when it comes to our airways, literally just the ways that modern living has impacted our ability to breathe, to chew, to use our facial muscles. And so Neel and I, we actually, this all started back in 2018. I met Neel's brother, Arun, and he mentioned you to me, and he mentioned me to you. And so eventually we met up. And so what we're going to be talking about is basically the area that you have focused in through, really not on purpose. It just happened.
Yeah.
It's just sort of happened. Right. And so if you don't mind, just kind of, we were on Instagram Live. So just so everybody knows. So what happened was we had a plan. And so I've been getting ready for the language of breath worker school. So like I'm going a million different directions, and it's just been crazy. And the original plan was go on Instagram Live. And then we were like, no, let's do YouTube. And then for some reason I had a brain fart, and then I was like, yeah, it's Instagram Live. And you were so gracious as to like go along with it for a while. And I appreciate that. And then eventually Neel was like, weren't we going to do it on YouTube? I was like, oh yeah. So here we are.
Well, here we are. Maybe we should riff on 2 things. One, the plan.
Yes,
the plan almost never works the way it should, right? Also, let's riff on brain farts a little bit too.
Yeah, let's talk about that.
If we can clear these 2 things out in 5 minutes, then I think people will be like, all right, so I understand Neel is a person who doesn't go with plans because, intuition is better than a plan usually.
Okay, there it is.
If you don't have a plan, sometimes you don't have a place from which intuition can work. So I love that.
Yes.
Interplay, right? And then brain farts are like, well, if you have a brain fart, you can't think through a plan. But you know what? One of the number 1 causes of brain farts is tongue tension. So flow the mouth.
Here it comes. Here it comes.
That's right.
I like it. I like it. So let's talk about it.
Yeah. I mean, I feel like what I didn't think of starting the other one is I'll start this one out with, we'll do a little tongue mobility, free up our tongues. And then that way we'll start off with a little bit of a freer brain with more optimized cognition and less brain farts. So
I need
so
something.
I didn't do you a service, Jesse. I didn't do you a service. I didn't start our time that way, because then maybe this could have been a different. So I'm just kidding.
Yeah. I don't know. It's got to be pretty strong for my brain farts. So let's do this.
So let's do it. So it's very simple. If anybody, you're gonna basically be, grabbing your very gently, grabbing your tongue with your fingers and stretching it. So if you want to wash your hands, you can. I'll give you like 10 seconds to do that, 20 seconds tops. But and with this, just know that this is a mini micro, quick version of the full thing. I'm not gonna go into the full, because I have this 8-minute daily routine that I put in my product called Tongue Press, which is all about how you can free the tongue on a systemized basis. But we can do like a 30-second routine that'll at least give us some freer tongues and see, is my tongue tight, right? Because anybody, if you're watching this, Jesse asked me in Instagram, was like, how do people know if they have a tongue tie? So I said a lot of words, but in one way, we can just see if your tongue's tight, and then
let's do it.
At least that'll help. So first of all, I'll talk you through this, but I won't do it because then I can't talk.
That would be difficult. Yeah, that.
So you're just gonna stick your tongue out, and then you're gonna gently squeeze your tongue with your fingers, and then you're gonna stretch out just a little bit until you feel a tug. Now that's a good stretch. What you're then gonna do is you're gonna do what I call pluses and X's. So you're going to, keeping it stretched out, you're going to go left, right, back to the middle, and then just a little up till you feel a tug, a little down till you feel a tug, back to the middle. And then you're going to do your diagonals, which is the X. You're going to go like up into the left. Yeah. There you go. Down into the right. To the middle. And then up into the right. Down into the left. And then back to the middle. Great. So you've just done tongue mobility. Now the next layer is, I'm just going to tell you how to do this, Jesse. This is a perfect example. So now if you feel under your tongue, that's the floor of the mouth, right? You have, so put your finger under your tongue, and you have this, it's a group of muscles, 4 muscles. They're called the floor of the mouth muscles. And if you just feel them like that, you feel them, and you can feel, how do those muscles feel? Are they tight? Is one tighter than the other side? You can kind of feel, is there tension there? Well, chances are it's going to feel a little tender and there's going to be a little tension. Well, another way you can check on the tension is then you can go ahead and you can try to lift up with your finger to get the tongue, especially the back of it, to stretch up. Yeah. So you can get your finger as far back.
In the back?
Yeah. Far in the back. And then you try to lift up to get the back of the tongue to lift. And then that's the right side of your tongue, right? Now go to the left side of your tongue and feel that floor of your mouth with the fascial or muscle tension. And then you're going to feel what that feels like and try to lift up and get that. And if you feel any tension at all, any tightness at all, that means you need this. So that's hands down. Okay. If you feel a lot of tightness, a lot of restriction, it may mean you have a tongue tie, but we don't know yet. It's just a little bit of a screen to see.
So, yeah. So now I didn't feel, I don't know if I felt, it's just, I felt like, okay, I got my finger under there. It's a little uncomfortable,
Yeah, that a little uncomfortable. Right. That means there was some tension.
Hey, okay.
A little discomfort means
fix me, doc.
But yeah, no, it's crazy. I was just working on somebody, and as soon as I touched the floor of her mouth on the right side, her eyes went like this, and I'm not touching it. I'm barely at all. Yeah. So also that is skin sensitivity, and that's a different nerve, but it's another indication there's a potential tie, is because you may not be putting any pressure at all, and it may not even be that tight, but the nerve pattern may be disrupted, and that could be from altered nerve flow due to the potential fascial restriction that's there. Whether it's a tongue tie or not, in one way, it's not the main thing. It's like a thing to figure out along the way, but discomfort is a sign that there's an issue, and at least it could be helped some through movement. So now if you did that exercise, why don't you go back through, and this is the end cap, the sandwich, if you will, of the tongue freeing. If you go back through that tongue stretch routine and you just go and you take your tongue, stretch it out, and then do the pluses and X's, then that's your way to see, did it change at all? Is it a little easier for you to stretch to the right? I mean, I can see your tongue moving a little more easily, and then back to the middle, and then you go up and then down, and then do your X's. Yeah, great. So you run through that whole thing, and you might find that, ooh, that's a little bit easier, or at least I feel like it loosened.
Yeah, so it's not an everyday thing for me. I know after a while, I'm sure you've got more practice handling tongues.
Yes.
But I'm like, it's slippery. But yeah, I can see that. Yeah. Okay, cool. I did feel like it was a little easier.
So let's just say that's like a 1 minute version, or that's a 1 minute section of my 8-minute daily routine video on how you can free the tongue. There's a whole lot more, but to get into the nitty gritty of that, I would just say, just hop onto my tongue press course. You can get through, my links in bio and on Instagram, or we can, send out that link, but it's.
Yeah. We'll put that in the show notes after this is done, just for anybody who's interested. I know you've got a class, an online
Yes.
course on just like straight up how to get this done, how to do that, right?
Yeah. And the that's what the floor of the mouth is, the door, to the diaphragm and better breathing, to better digestion, to kind of all those things is so the floor of the mouth course is more for like, well, like for like you, if you've got breathwork practitioners who
Hmm.
listen in and tune into you, if you've got any body workers, chiropractors, osteopaths, physical therapists, and or if they do myofunctional therapy, or if they do dentists come to take my course. I've got some providers all across the spectrum, but then there's even some parents who they're trying to guide their little ones, their babies, their toddlers, their kids in healing, and they're
Yeah.
healers. So this is really for
Yeah.
any healer out there who wants to heal well, but also if you want to learn how you can spot and help your family or anybody out there, yoga teachers, things like that. You're like, why is that student never able to do that? Well, it might be because
Right.
the floor of their mouth is tight, and at least they could be clued into how they can help that person.
Now, how common would you say it is for just the general population to
Yeah.
have an issue like that, or like
Um,
any of these issues of the mouth, right?
Totally. Yeah, yeah. I mean, the way to say it is like we were talking a lot about tongue tie about 5 years ago. We still are, and there's a lot of people who are just getting, tuned into that. Now we're talking about airway and
Hmm.
airway centered issues, and we talk about craniofacial issues. That's the broader characterization and talking about that, because it used to be they said 2% of people had tongue tie,
Yeah.
but that's a crazy low stat.
Wasn't it that if you had a tongue tie, you were supposed to just wait until you fall down really
Right.
hard and
Yeah.
it would free you of a tongue tie?
Oh man. Well,
that
and that's like, yeah, that's the
was
crazy.
the solution,
That was the
right?
solution. Yeah. And it's crazy because I've seen a lot of people come in and I see that they fell when they were a kid. And so I can see the scar tissue on their upper lip. There's an upper
Yeah.
lip. That's a lip tie. When there's a frenum there that's restricted. A frenum is the tissue that is restricted or tethered or tied when there is a tie, whether it's a tongue tie, a upper lip tie, lower lip tie, upper cheek tie, lower cheek ties. There's 7 potential ties that we can all have. We all have 7 frena or frenums.
Okay.
So whether they're tied or not, that's the question. And so upper lip ties are the most common ones that will release at 2 or 3 years old when kids fall and it rips and they don't
Okay,
even
so
know it.
that one might actually
Maybe.
be the thing they were
Yes.
maybe.
But I see the scar tissue there and I work on that 10, 20, 30, 40, 50, 60, 70, 80 years later. And
Yeah.
most of the time it's not a huge thing, but sometimes that scar tissue creates more tightness that needs to be worked on.
Oh.
So an improper release, even if it's a provider who doesn't optimize or doesn't specialize in this work and they just do these, that's also not really what I recommend. But yeah, the tongue is way less. I mean, I can't even tell you of ever hearing of somebody's tongue releasing on their
That
own.
would be such an odd fall, wouldn't
No,
it?
so
I don't.
traumatic,
I mean,
so
it would
traumatic.
maybe it would release your tongue tie, but then you'd be,
Yeah.
a vegetable
Oh my
in
gosh.
the hospital.
Yeah.
Because I
So
mean,
the tongue is, oh, it's so much. Yeah. And then there's maybe to say one more thing about the tongue is that
yeah.
there's an anterior tongue tie where the frenum goes all the way to the tip of the tongue and you can see it clear as day. And then there's a posterior tongue tie where the frenum only goes about a third of the way up from the
Hmm.
back. And actually, it's now being changed to be called a mid tongue tie because it can go to the middle of the tongue. But, anyways, that's harder to spot. That gets missed by people all the time. I have airway providers who I respect a lot, and sometimes they don't see it and they don't catch it, so I catch it, and I'm like, ooh, that one has a posterior tongue tie. And now the dentist I collaborate with, Rachel Barnhart, she's brilliant. She will say, I can't see a tongue tie there, but I wonder if there is because they have the symptoms. I need to send you to Neel because sometimes fascial work and body work can evoke or bring out a hidden restriction. Because if muscles
Interesting.
loosen, it allows for the muscles to let go. And then they're because they're compensating for the tie that's there. And once they loosen and lower, then you can see it. Oh, there's the tie it was hiding all along. That's
Hmm.
a nuance thing and that's tricky, but that's what I do is I get into the nitty gritty and the very, very micro molecular areas of this field because when a little baby can't feed well, man, you need to
Oh,
figure out. how to
Yeah.
help them. Or
Well,
when a 75-year-old who came in with severe TMJ and his head hurt like crazy, well, that 75-year-old ended up needing a tongue tie release, but the body work we did was a huge part of preparing him. So whether it's a baby or a 75-year-old, sometimes you have to get really particular. Just to give everybody a context, I'll take like one more minute and then I know you had a thought, but a
oh yeah.
75-year-old, I was working on him and I'm like, wow, first of all, he had a kidney removed when he was, younger due to an issue. And because that kidney scar tissue was pulling upstream into the mouth, it wasn't until I released fascia on the scar tissue of the kidney that his tongue would loosen. That was awesome. That was crazy. Now, here's the next thing. That was good. And I was doing well, preparing him for his tongue tie procedure. And I'm like, all right, we're good. We're good. But then I'm like, man, it is so tight in there. Why are we not loosening this as well as we can? So
Right.
then I thought, muscle tested him. So, anyways, I found out, I wonder if his hearing aids are interfering. So I had him take out his hearing aids. Boom. The floor of his mouth loosened. His pterygoid muscle, which is the jaw muscle, loosened. His cranial bone, called the temporal bone, released. And it was the first time in years that he experienced relief. And that's why he went to the dentist. He went because he had TMJ, head pain. So when we took the hearing aids out, whether it's the plastic or the EMF or the downright agitation of that device in his ear, loosening it stilled his nervous system enough, calmed down the vagus nerve, enabled the parasympathetic nervous system to work. Boom, loosening of the fascia. And so right there, his tongue loosened up some and his jaw muscles loosened, and we were able to get the adjustment. That's kind of the way I
so
work.
so I guess the next question is, did he put those? I mean, of
Yeah.
course he had to put his hearing aids
Yeah.
back in.
Well,
Uh,
I do
uh,
something. Go
yeah.
ahead. Sorry.
I mean, just how did that story unfold after that?
Yeah.
Did it go back to him having the trouble, or how did you go
No,
from there?
no, because I work meticulously back and forth, hearing aids
Yeah.
in and out to titrate his body to
Oh,
customize
okay.
to freeing myofascial tension with both the agitation in and out. Because I knew he can't do without them. So the goal
Yeah,
wasn't,
right.
hey, don't wear your hearing
Yeah,
aids,
right. A
right?
simple solution. Yes.
But what a lot of us do, I know a lot of brilliant body workers, myofunctional therapists, but what a lot of us do is at that point say, well, they're going to wear them, so I can't do anything. And I'm like, well, but if you do that dance back and forth through sessions, I
Hmm.
got his mouth and his fascia to loosen with the hearing aids in over time. So his
Yeah,
body was able to decouple fascial tension from the sensory interference from the hearing aid.
right. It
So,
was doing this thing to protect him.
yeah,
On an
exactly.
unconscious level, of
It
course,
was the,
people, who listen to my stuff all the time, you've read my book, and I'm all about all these unconscious processes that are there to try to protect you. But it just didn't, but you just had to kind of teach that part of the client, hey, this isn't there to hurt you. And
yeah.
how long did that take to do?
Boy, yeah. So because he lived, okay, so here's the thing.
Yeah,
75 years old, turned 76 during, when we were
sure.
working on him. And then but you say so that problem has not been with him for 75 years because tongue tie, pellet narrowness, those things, they started 4 or 5 weeks in utero. So if he was 35 weeks gestation, like after that, meaning if his mom went full term, which is 40 weeks, that means he came into this world with 35 weeks of issues with tongue
Already
tie,
there.
palate narrowing, cranial bone stuck, all that stuff. So then we have, we're talking like it's not that much more, but it's 75 years and 6 months, right? So,
Well, yeah. Okay. I'm
right. So,
still.
if he was 75, that's 75 and a half years with the problem. So it took
Yeah.
time to untangle, disentangle. And it took a few months overall to get him ready for his release, to get his
Yeah.
release, and to help him after. But a few months for a problem that's there.
That's been
And
with him for over 75 years.
yeah,
Uh,
that's
and a person, when you come into this world and all you've ever known is that problem. I mean, talk about, wow, what a change that must have
yeah.
been.
Yeah, he's blown away, and he's like learned so much about his. One thing I'll say that's common about anybody that comes in and they go through this experience, and I know there's other people out there like you've seen this through your breath work is like people get to know themselves They
Yeah.
it's not that they
Yeah.
didn't know themselves, but they know now why things were the way they were. And they're like, this makes, I've seen so many people feel validated by the addressing of this. And I feel like the energetics of validation, which my wife Dawn is got a pursuing her PhD in healthy emotional validation, and she talks all about this. But the energetics of validation are so massive because, like you said, it's about the nervous system and about
Hmm.
regulation. It's like if we get validated, we feel safe. And if we feel
There it
safe,
is.
our bodies can relax and can
Yep.
stop protecting. And if we can stop protecting, we can stop guarding what we don't need to guard from. And so I've seen so many people melt on the table due to being heard, for the first
Hmm.
time. And in one way, it's like, yeah, I'm pointing out a problem that's been there for a long time. And that can be stressful for a person to realize that they've had something since before they were born and what can they do about it. But
Hmm.
when they see that it's not, it can be involved. But just a little relief on an area that they've never had relief in gives them hope. And then they feel
Yeah.
like, oh wow, this makes so much sense.
Now, when you talk about doing a release, is this the sort of thing that, and I'm sure, I'm sure it varies from person to person, but when you talk about
Yeah.
doing a release, is this the sort of thing that you might have a single release and then, hey, I don't need Dr. Neel anymore. Or is this usually kind of probably the sort of thing that you still need to come back for adjustments and for,
Yeah.
maintenance?
Well, yeah, it's a good thing to discuss, and it's because it's a relevant thing. Because something for context here is that I've created the field of integrative airway and feeding chiropractic.
Yes, which is
Right.
amazingly cool. Yeah.
So in that I created it because it's what I do, and now, almost like sadly, I don't see a lot of the people who don't deal with these issues because I'm a specialist, and because I've created the field, I'm the only one that does it, but now I'm teaching and training others. And so now I know you're a pioneer as well. Like when you create something and you understand something,
Yeah.
you're figuring things out. And then you're like, well, but you gotta make sure that you're helping other people because I can't help everybody. And not
Right.
am I, not only that, but and I'm not the best person to help everybody. Um, but yeah, when it comes to navigating like the most common questions I get from parents who bring their little babies in is, can this body work prevent me from needing to get this release for my little one?
Mhm.
And adults have the same question. They're like, if I come into you, is that going to take care of the problem? And I'm like, it depends on what we're talking about. If we're talking about symptomatic relief and feeling much better and maybe not feeling like we're having any problems, a lot of the time, yeah, I can help with that. And hey, for some people, that's all they want.
Right.
And then for some, they're like, but what about this and this and this? And or they go through that and we do the body work and then they're still having the issues. Or I do body work and it's not resolving it. And I'm saying, I get pretty meticulous. So I see a lot of cases just are so much better without the need for surgical intervention, which are the tongue tie releases,
Mhm.
that it's beautiful when I see that because it's not my goal is to send them for a release. My goal is to do the best that I can. But then to say, if I see that they're recurring the same problem over and over again with fascial tension and the muscles and the organs won't release, and I work on all those areas, or I work intraorally, I work intranasally to open up deviated septa, right? I work on all that stuff. And if that's just like I keep needing to do it over and over again, something's going on. I'll look at the sensory system, I'll look at pathogens, I'll look at are the lights too bright in the room? I'll look at energetics. I'll look at empathic realm. Is this a pain they're picking up from somebody else or tightness from their mom, dad, or grandma? Tons of cases I could tell you examples about. Um,
We need
man,
to
I mean, there's
open
just
an office together because all of these things are so perfectly interwoven with what I do. You
totally,
know,
man.
it's one of those, and this is why for those who are watching, thank you for being here. We're going to do this again. And it's one of those things where I'm fascinated with what you do, and when we start to understand ourselves better, it's a very firm belief that we often, we speak in metaphors, and then we start to understand everything in that metaphor, and sometimes we over literalize those metaphors. And one of the things that I always talk about is how we see ourselves as machines, and
Right.
we don't see ourselves as these holistic organisms, that everything's in relationship to each other. And when you talk about these things that we don't we like if we were a machine, it just wouldn't make sense, right? It's just like how could this doesn't make any sense why this would affect that. And but when you look at ourselves as like, okay, we are a complete organism. Everything is 37.2 trillion cells working together, and when there are issues in one place, it's going to affect everything to some degree. It just so fascinating to me. And now, before I forget it, I do want to talk about, you sent me a really cool graphic talking about the tongue and the diaphragm and the relationship between these organs that we and I'd love for you to explain it. I know we're not going to be able to show the graphic. Next time maybe we'll be more prepared. Again, just for those of you who are watching or maybe who just jumped in, this started as Instagram, and then we moved over here, and I've just been a mess getting ready for the Language of Breathworker program. So maybe next time I can show this graphic. But can you talk about that relationship between the tongue and the diaphragm?
Yeah, I would love to. And I was gonna see if I could pull it up really quickly
Oh,
because
cool.
I think that would be a really just helpful way to to just quickly talk about it. Yeah, and so I got the graphic right here.
Are you
And
able to share? I know they just updated Zoom.
yeah, let me get it here. And oh yeah, so let me just go to Zoom, get that right on there. And we'll go to
And for
share
those guys who are
screen.
watching, we're going to be here for another probably
Oh,
around 20
can you
minutes.
disable my, or can you enable my screen sharing
Let's
on
see.
the settings?
Let's see. Here
On
we
more?
go.
I think you just go to more.
Just go to more, and then
Enable screen share.
Oh, Neel. Let's see here. I tell you what, I don't know how to do that, but
That's
I
okay.
do know how to. Maybe I can do. If you do. I tell you what, send it to me real quick and I'll share it. Paul Stone King is here. I think if you made him co-host, oh my God, that's how bad it is. Now, thank you so much, Paul. I'm getting everybody's like, maybe if you do it this way,
I know,
that's
no,
how
no.
you know.
I'm putting you on the spot, Jesse. I'm
It's
putting you on the spot. So I sent it to you. You'll get
thank you.
there's four images. Just pick one that says
Yeah.
diaphragm, and you got the right one.
All right, Paul, I want to thank you for making that suggestion. It's like watching, what is it? It's like watching your grandparents try to do the internet. It's like, yeah,
No, it's great.
where's
I've
the
had so many
CD
people.
drive on this thing?
Well,
Oh,
it's like we're a village, right? So people want to help.
yeah,
They love
I
you.
do
So right.
appreciate it. And Paul,
That's
he's normally helping me out one way or another. Let's
that's
see
great.
here. All right, I'm gonna see if it's gonna pop
But you know
up.
what? While we
Let's
do that,
just
I'll
talk
talk
about
about
it.
it. I'll
Yeah.
talk about it while you could keep working on that, and I'll just explain. The diaphragm, we all think about it as this it's muscles, and it's I call it an organ because it does so much for us. So it kind of has that functionality in the body. Muscles move things, organs make us function on a cellular level. So I call the diaphragm an organ. And but what's really phenomenal about it is that the diaphragm, when we form at 4 or 5 weeks, the diaphragm is located in the throat, and that's where it is. Because right now it's in the belly. Most people know that's where your diaphragm. You put your hand on your belly. You're trying to belly breathe. You're trying to get your midsection to diaphragm to breathe. And so this one's the power of the breath, which is a really good one. The
Oh, wait a minute. I'm doing the wrong one? Of
It's all
course I'm
right.
doing the
If you
wrong
if you
one.
look at this one, this shows something really good. No. This is good. This is better for context. Look at, if you see there's the pelvic diaphragm, that's lower, that's at the hips, that we have 14 functional diaphragms in the body. The diaphragm in the belly is just the one that we know. But these other areas, they're in the wrists, they're in the shoulders, they're in the elbows, the knees, the ankles. But we have the pelvic diaphragm, which is called the pelvic floor, that works as a diaphragm. Then we have the belly diaphragm, but then we have the oral diaphragm. This one shows the floor of the mouth as a dam. That's an analogy that I use. But that oral diaphragm is what the floor of the mouth is, because it works as a regulator of interstitial fluid. What that all means is that it's just about flow. And we can't flow well in movement, breath, if the diaphragms don't work. So when the mouth is not working well, is not free, is too tight, tongue tie or not, then the floor of the mouth cannot work well. And then the oral diaphragm doesn't work well, and the whole body can't function, including the diaphragm, well. But if we see here, if we look at the diaphragm and we think, okay, if you look up in the mouth and think where that floor of the mouth is, that's where the diaphragm starts in utero as a baby. Then about 6 weeks along, it lowers into near where the heart is. And then about 8 weeks along, it ends up where it is. So that's crazy, because if we think the diaphragm has always been where it is, that's not how we're made. And so then we think, how could a diaphragm, how could the whole body, and how could a diaphragm be so affected by our breathing? Well, it makes sense without even knowing this. But if breathing requires our tongue to go to the roof of our mouth so that we can breathe in through our nose so we can get optimal oxygenation with the right pH, all that stuff. Well, if our tongue is tied and we can't do that, then that whole mouth area is so tight. And if the mouth area is so tight, well, tongue ties start in utero right at the same time the diaphragm forms. So all of that's happening right there, right then. Tongue ties, mouth gets tight, diaphragm gets tight. So if we imagine the diaphragm descends in development down, well, it's kind of like it's not able to descend as easily. It's fascially bound. So it tightens stuff all the way down to where it ends in the belly. Some of this is known, and some of this is what I'm putting out there into the field, because I'm a student of and a examiner of embodied embryology and the interplay of embryology related to tongue tie and oral restriction. And so this is actually a really cool graphic because it alludes to the tongue tie map or the airway map that I produced. And it has 70. This is a really cool, fun, artistic description. But I have another map that has 70 points on the body that all bind up and tighten when there's a tongue tie or a narrow palate. And so it's crazy how connected we are, right? Interconnected.
Yeah.
It's so connected. So so this was a good one. Now, if you go to that other graphic, it's the second one or the fourth one. That one, that one's the diaphragm one, but we don't even really need it. If we want to do it, we can, but I described kind of everything that one described and more. So no sweat if that's not happening.
What's it called? Embryology of the diaphragm?
Yeah, exactly. All right. Exactly. And so if we go to that, we could just talk for a minute and then we can get on to some more fun. But
let's see here. Bear with me just a second.
I'm making you sweat. And then
I'm loving it. I'm doing my breath work right now.
That's right. Through the nose. And then, right. So
all right. So embryology of the diaphragm. Okay, here it is.
Yeah. And one other thing I'll say is that, like, this is a cool diagram because if you look and you see, oh, you know what? If you click on the other one, I'm so sorry. If you click on the fourth one, that's the poster. Yeah. So that's that's so you can get the poster hung up in your office or your your room. So if we go embryology to diaphragm, that's where it shows the diaphragm develops, starts in the neck, in the throat, and then as the embryo develops, it travels down. That's where it ends. Well, this diagram doesn't show it, but if we all think about how we form, we start out as these little curled up, flexed beings, right? So how far is your foot from your throat when you're a tiny being before you even become, when you become a fetus? An embryo is what you are before you become a fetus. These names are important mostly just because of the anatomy and as we develop. But if we think we start out as these curled up, flexed in a ball beings, well, if you have tightness in your throat and you have tightness in your ankle, they're so close together. Why wouldn't they be, right? So we have to think like a baby. It's in order. We have to think like we started in order to imagine, how we came into this world, because those things are with us. And that's so relevant to how we can not only understand ourselves, which is what this is. It's a awakening process of discovery that I'd like to lead people on. But it's also like, how can I loosen up something? Well, almost always, if somebody's got really tight calf muscles, work in their mouth or look there, because that's inevitably going to be the root of that calf muscle tightness or hamstring or many other areas. So yeah, so to kind of conclude on the diaphragm part, um, even though you know it, it's this two-way street, because I know you're seeing people get better through breath work
Sure.
because the breath work helps their diaphragms move in a better way. Because I can dig into people's diaphragms all day long, but if they have improper breath work mechanics,
Hmm.
I can exhaust myself and I can tell them to dig into their diaphragm, but it won't work. You need the neurological, the physiological, you need the beauty of the benefits of proper breath work so that the diaphragm can stay moving and stay functioning optimally. So it's like breath work is so necessary and important for living. And it's also a
Right.
huge part of what I dabble in teaching. But obviously, if you lived in my city, I would be sending all
Oh
my people
man.
to you, right?
I would have your fingers in my mouth just all the time. You know, and this brings up, one of the things that I'm really excited, and for those watching, we thank you for making it this far into our conversation,
That's
and
right.
and this is where you're going to start seeing just a bromance occur, because I'm so fascinated, and I think there's so many crossovers
Yeah.
with how our work, we're working with a lot of these same things. I'm curious, as far as when you're working with people, the degree of emotional
Yeah.
release that you're seeing, because one of the things we see in breath work over and over again, of course, breath work is a large field, and there's a lot of well-meaning people who are like, hey, I'm going to fix all your problems in one session, right? And
Right.
there's a lot of claims that are made, and a lot of garbage that's out
Yeah.
there. And one of the things we do in language of breath is we really focus on learning how to be okay with the way that you feel, understanding that, we have embodied emotions, right? So
Yeah.
we feel, we have a felt sense of emotions. And so learning how to have something, sometimes we call it conscious reappraisal of these sensations. And it's like, okay, so we can start to learn to feel okay with however it is we feel. But I can only imagine. I mean, it sounds to me like you're working with a lot of things on a very visceral level that might have very similar effects.
Yeah. Very much. And I'll use the play on words because the
I like
visceral
play on
system
words.
is organs, right? So
Ah,
I love it. That's why.
all
That's
right.
why.
Puns are kind of my thing too.
Totally,
So,
man. I
I mean,
love it.
we're again, bromance is occurring just on live on YouTube.
I
But
love
go
it.
ahead. I'm sorry.
Well, yeah. I mean, and often the visceral system is exacerbated or aggravated by visceral issues or emotions or trauma so much of the time. And a lot of people can't get out of their heads enough to access these emotions, or they're and I'm not blaming them, or they've been through such experiences, whether it's like constant stressors to trauma to
Mhm.
those kinds of things, where it's not under their control necessarily. They're subjected to a high amount of stress, and then a lot of people now, they know, like, people come into my office and they're like, yeah, I carry my stress in my shoulders, or I carry my stress in my stomach. Or this one speech language therapist I take care of, she grieves the loss of her son, and so she says, I always feel it in my stomach. And that's, we'll work on her stomach. But this is a good example of, I was working on her stomach and she right away goes, "Ooh," and I said, okay, that's really heightened sensitivity to your stomach. Maybe I need to lighten up, but I'm being pretty light. Let me check
Yeah.
in with you. This is before I knew she carried grief in her stomach. I was like,
Hmm.
is this about the loss? And she said, yeah, it's my son. I was like, okay. Um, anyways, I'm putting in a nutshell what took longer to unwrap, but we went
Sure.
through
Sure. Yeah.
a few minutes of dialogue about how there are things that she was having trouble with when it came to grieving and what brought it up, and in this current season, right, years later.
Yeah.
And so as we talked about it, the conscious utterance of the issue with attaching it to the stomach and knowing that helped sift through things to where when I touched her stomach again, it wasn't sensitive. And that's
Mhm.
because she was able to express what was on her heart. And sometimes somatic work looks like that, right? I engage in
Yeah.
somatic work. So that's a very real, like, and some people don't even know that they have the trauma or the grief. And so on that end, that's a trickier one. But I always ask these questions of like, anything happened with you around this age, and
Mm.
have you ever had anything go on like that? And so then I say, okay, well, it happens to be living in your stomach. It happens to be living in this part of your body. So let's explore a 2-minute conversation about this. Or if you're not comfortable with that, let me know. And also then I tend to give people homework if we're like doing all this and I'm like, okay, I think if you go home and if you journal or if you draw or if you color or if you sing or do spoken word, whatever it is that's coming up in the moment, I feel like you're going to allow this to proceed further. So the visceral and the trauma and the emotions, it's a swirling, beautiful mess, I call it, because it's like, it's never
Oh yeah.
one thing, right? It's
No,
like,
and that's I just to piggyback on that, that's the thing about emotions where there's is, and so a lot of times I'll lead people through exercises to just to kind of demonstrate the fact that we feel emotions physically, right? That they're
yeah,
not this, and I know it seems obvious, we literally call them feelings, but it is something that I remember the first time I really put that together. I was in my 30s, right? It was like, wait a minute. How did I not put that? I think a lot of us over intellectualize it. But
yeah,
to say, well, how does it feel to, go through, whatever experience? It's exactly what it is. It's a mess. It's a splattering of all these different emotions that are coming up that are in a lot of times I think we want to interpret them and read the tea leaves and things like that. And it makes them even more scary, more intimidating. And it makes us not want to feel, and we do a great job of avoidance and suppression, and so I think it's fascinating that you're working on a very on a physical level with those physical sensations, um and I can only imagine. I think it's I you know and we don't have a whole lot of time left, but I think I'm just so excited about what the future holds because just think about, you didn't know this existed when, I mean, how old is your daughter now?
she's 8.
8. So 8 years ago.
Yeah.
Like, think about how far your understanding has come in just, I mean, that's nothing. 8 years. And I remember getting into breath work, in like maybe 10, 12 years ago. And that was still when we believed, things like you're going to hyper oxygenate if you breathe hard and full, then you're hyper oxygenating your bloodstream and you're killing. I mean, there's a lot of the myths that we used to believe, and so we've learned so much so fast. Um, and, and I think we're just getting started. So
Yes.
Neel, before we finish up, because I do need to close up, we're going to do this again. We're going to do this.
Yes.
This is something I'd like to maybe dig in regularly. So for those of you who would like to ask questions, I know Paul has a question here. How can people get a hold of you now? How can they get a hold of that course? Because I know I think this is something that you're going to empower a lot of people in ways that we just never thought. Still to this day, a lot of people, whenever I say, yeah, I do breath work, and they're like, does that even do anything? Like, it's like, what? I think you're going to empower a lot of people in ways they didn't even know were possible. So I'm going to put these things in. I tell you what, if you just email me all your details, I'll put
Yeah.
those
And
in the
I,
show notes.
perfect. And I
I'm
put
going
in
to
the
put your
chat
email
box,
right
right?
now. Yeah.
Perfect. I just threw into the chat box my Instagram where you can get all the links to all my classes and what I do. And then I also put my email if you want to reach out and people want to reach out. And then, yeah, I wanted to say, like, and I think, Jesse, you're going to share, the link to my courses and things
Mm-hmm.
like that when you get a chance. But it's,
Anything you
uh,
send me, I tell you, just after this, just send me anything you want me to put in the description
yeah,
box.
perfect. So there's 2 courses that I'm really excited that and one I talked about, with Ben Greenfield after I did body work for him, which is tongue press, the ultimate biohack to freeing tension in the body. That's for anybody with a tongue, whether you are a practitioner or not.
Yeah.
If you have a tongue, and even if you don't, you still have tension there, right? From where it used to be. So I'm just kidding. That's not a really good joke. But you need this. You need tongue press, and it's a it's a course. You go through it and you learn the daily routine of how to work on your own self to free up tension. And then there's a more higher, like advanced level, higher level course that's called Floor of the Mouth Interconnectivity Unveiled, where I distill and unveil the mysteries of how I came across this understanding and how I'm now disseminating this knowledge across the board to providers globally, because I want everybody to have this knowledge. And so it's a 6-week class, starts July 17th. It's a live Zoom, recordings available till the end of the year. And obviously that's for practitioners mainly. But if you're a parent and you just want to figure out healing and how to guide your family, that's good for you too. And so these are really great because they allow like this knowledge that isn't yet out there in the field. I'm sharing it,
Hmm.
and I'm riding on the shoulders of giants who have foreran this field of
Yeah.
Airway, and but I'm also one of them, and I'm also one of them who is putting out knowledge that hasn't existed before. Because, like you said,
It's
I've come a
beautiful.
long way in 8 years,
Yeah.
but I want people to get in weeks or months what took me 8 years to figure out, and so that's
Yep.
now my goal.
That is a beautiful goal, and I'm excited. And for those of you guys who can sign up for his thing on the 17th, that I think well worth it. I know we'll be talking on this channel more often,
That'd be great.
and Neil and I have just gotten to know each other, and so look for other opportunities to learn, maybe even hang out with us. We're talking about possibly some kind of a retreat or a workshop in the future.
Yes,
So
totally.
we're kind of tossing around ideas. So look for more opportunities in the near future. Make sure to follow Neil on Instagram
Instagram.
and
Yeah.
sign up for his newsletter on his website. His email address, I put it in the chat, but I'm also going to put all of his information at the end. So thank you so much, Neil, for being here. And I look forward to our next conversation. Stick around for just a second. I'm going to take us
Okay.
off of the broadcast for just
Perfect.
a sec.